po mga viewers, nandito na naman po ako para sa isang topic. Continuation po itong ng mga nakarang kong vlog. It's about respiratory tract infection. By the way, salamat po sa pag-like, sa pag-share at sa pag-subscribe. For any comments po, pakilagay na lang sa ibaba ng video. Ang aking topic po for today is about lower respiratory tract infection, kaya continuation ng mga nakarang video. Ngayon po ang topic ko is bronchiolitis. Okay? So, doon po matatandaan ninyo yung mga una kong mga video. Sinabi ko na yung trachea, which is the windpipe, will branch into two tubes, the right and the left bronchus or bronchi, and then yung pong bronchi, right and left bronchi will branch into smaller tubes. Yun po yung tawag ay bronchioles. So, pag na-inflame po yung maliliit na tubong yun or the bronchioles, yung po tawag natin dyan is bronchiolitis. Yung pong cause, majority pa rin po dyan is viral. Yung mga respiratory syncytial virus, flu virus, yung common cold virus, yun po yung karaniwan, nagiging dahilan ng condition ng bronchiolitis. Ito po ay very common infection po sa mga bata. Manner of transmission, katulad din po ng lower respiratory tract infection, droplet transmission, which means pag merong bumahin or umubo without covering the mouth and the nose, syempre masususpend yung virus sa air, and then yung susceptible host, malalanghap o ma-inhale nyo yung droplet na yun containing the virus. So, papasok sa katawan ng susceptible host, and that could produce this kind of inflammation, bronchiolitis. Another method is yung manner of transmission is yung pag yung isang infected with the viral infection, nag-ubo or bumahin, and then kinover yung bibig or yung mouth by way of the hands, tapos nag-touch siya ng surfaces, so contaminated ng surfaces. Here comes the susceptible host, sinawakan niya the same contaminated surfaces, natahawak din sa nose and the mouth. So that's one way, another way to transmit this kind of infection. So for the risk factors, karamihan po ang bronchiolitis affects those under 2 years old. And then another risk factor is premature birth, yung kulang sa buwan or araw. And then the other risk factor would be those with underlying heart and lung condition. Another risk factor po yung merong depressed immune system. So, mahinang resistensya. And then, isa pang risk factor yung expose sa tobacco smoke. So, sa mga may naninigaril yung mga household members, at risk po yung mga bata na mag-develop ng bronchiolitis. And then, may another risk factor yung pong hindi na-breastfeed. Yung hindi na-breastfeed, meaning from the start, naka-milk formula sila. So, that is a high risk for bronchiolitis. And then, of course, as with the other respiratory tract infection, madalas po rin makikita yun sa mga childcare setting or spending time in a crowded environment. Okay? Sa mga sintomas po, karaniwan dyan ay nag-i-start as pwedeng runny nose, stuffy nose, ubo, fever, or kaya yung wheezing, yung parang pumipito pag humihinga. So that's wheezing. Minsan yung iba nagko-complain na medyo bata na nakakapagsalita na, yung body malaise. Okay? Pag magagawa natin to sa bahay, ang pwede natin gawin for this condition, pag may lagnat, ganun din, because it is viral, so it is symptomatic and supportive treatment. So, viral, self-limiting po yan. Pag may lagnat, kailangan antipyretic, paracetamol, or ibuprofen. And then, importante po yung increase yung fluid intake. Painumin natin ng mas madalas or i-offer natin na mas madalas ng milk formula or breastfeeding, and then soups for older children. And then, importante po yung plenty of rest para laging malakas ang ating immune system. And kung kailangan po ng antibiotic in cases of secondary bacterial infection, that's the time na kailangan natin mag-antibiotic, magbigay ng antibiotic. Kailan po natin dadalhin yung bata sa doktor in cases of this may bronchiolitis na yung ating mga babies? So one way is one condition could be like yun, nahirapang huminga, siyempre mabilis yung paghinga, yung medyo matamlay, poor oral intake. Siyempre, kailangan po yan ng madala sa doktor, yung maantok-antok, restless, and of course, pagka yung bata medyo, yung activity niya is very, very markedly decreased. For the prevention, ganoon din po, karaniwan sa mga respiratory tract infection or any infectious disease for that matter, importante po talaga yung hand washing or hand hygiene. One of the best preventive measures in the control of the spread of infectious diseases. And then of course, kailangan po turuan natin ng cough etiquette yung ating mga anak, lalong-lalo na yung mga nakakaintindi na. And then yung kailangan po akong merong mga smoker in the household, it's about time siguro na mag-quit because nagkakaroon ng malaking chance to contract this kind of disorder pagka merong pong exposure to secondary hand smoke. And kailangan din po siguro emphasize ulit yung importance of flu vaccine because flu vaccine, it affords protection against flu. So, hindi na po masyadong nagiging malaking problema pag nagkaroon na ng bronchiolitis. Para naman po at least din sa flu, meron na silang kahit na papaanong protection. Okay, I hope po nakatulong. Salamat sa panonood, and kung meron man po kayong gustong topic na gustong patalakay, paki-comment na lang po sa ibaba ng video. Salamat po ulit. Okay, hanggang sa muli. Don't forget to like, to share, and to subscribe. Bye-bye po.